It is said that the first shall be last and the last shall be first. To introduce the last amazing student, I want to bring up Jennifer Greer-Morrissey, who's the coordinator of the Tisch College and Tufts University School of Medicine Community Service Learning Program, and Amy Kulik, the Dean of Students at the Tufts School of Medicine, who will introduce medical student Emily Frank.
Hi, everyone. So last, but certainly not least, it is our privilege to introduce you to Emily Frank, a fourth-year student at the School of Medicine. As a Teach for America alumna, Emily arrived at Tufts with a keen interest in the connection between disparities in education and health outcomes. In fact, I heard about Emily before I even started my first day on the job at the med school, and sure enough, she came to meet me during my first week on the job to discuss her idea for a health education program in a school-based setting. I remember this meeting distinctly because although the project concept was still really taking shape, she was very, very clear about one thing about the program structure. She didn't want the medical students as the experts who would swoop in and teach the high school students about health. Instead, she designed a collaborative partnership in which the teens and our students work alongside one another with two main goals: to research health issues of concern to the teens, and then to co-create solutions to those issues. Thus, the Health Impact Partnership, or HIP, was born. Over the past 4 years, under Emily's leadership and advisement, students at English High School in Jamaica Plain have researched how issues such as diabetes, food access, substance abuse, and so on have affected their local community, and they've developed many health interventions to address those issues. Through her work with HIP and much, much more, Emily has inspired the teens and our medical students to look upstream to study health problems, and has empowered both groups to implement positive changes in their communities. We could not be prouder as Emily prepares for her pediatrics residency at the University of California, San Francisco with the PLUS program. PLUS, which stands for Pediatric Leadership for the Underserved, is a prestigious program which trains its graduates to be pediatrician leaders who are creating systematic and sustainable improvements to the health of underserved children. It is the perfect place for Emily to combine her skills as a future pediatrician with her visionary leadership. Emily's dedication to community service, population health, and social justice are unrivaled, and we are thrilled to present her with the Presidential Award for Citizenship and Public Service.